The Minister will be aware that I've been working to ensure that the MAT standards are implemented for rural parts of Scotland, such as Dumfries and Galloway and the Scottish borders. Can the Minister provide an update on how implementation is working in rural areas versus urban areas? And can she comment on how stigma reduction work is progressing in rural Scotland, such as through the importance of local recovery cafes like Borders in Recovery Group, which takes place in Hoyk, Gala, Kelso, Eyemouth and Peebles?
Minister.
Both small teams and those in remote and rural settings have particular challenges. However, ADP areas with remote and rural settings have demonstrated innovation in terms of maximising the use of technology and flexible models of care so that people could benefit from equitable care and treatment. I think those in our remote and rural communities have always had the adage that Hufty's a good meester, as my grandpa would say, and they are very innovative in their approaches. And Emma Harper has mentioned Borders in Recovery, and that's an organisation that I would like to get down to in the new year to actually meet and discuss with them how they deliver their support services within such a rural setting. But I am keen to make sure that we see our rural services develop. And we know that stigma prevents people from accessing the treatment and support that they need and that they are entitled to. And it can be the specific impacts in rural areas. There's work taking place locally to reduce stigma, with all ADPs reporting that they consider stigma reduction within written strategies or policies, including the MAT standards implementation plans, alongside a range of other actions. And nationally, we published our Stigma Action Plan last year, which outlines our plans to develop a voluntary accreditation scheme to tackle structural stigma and to implement a national programme of activity to challenge social stigma. And I will keep the Chamber updated on the progress of that plan.